Well, good morning, everyone. Thanks so much for joining us. I'm Kelly Morrison, Congresswoman for Minnesota's 3rd District. I'm also a physician. I've had the honor of caring for Minnesotans for more than 20 years. We're here this morning to discuss the threat that the proposed extreme cuts to Medicaid would have on our healthcare system here in Minnesota. I'm so grateful to be joined by some of our incredible leaders from the Minnesota Hospital Association, North Memorial Health, and Hennepin Healthcare System, who work so hard to keep our communities healthy and thriving. You'll get to hear from all three of them shortly. I just wanted to make a couple of key points here at the top. First, what we're here to do today is to make explicitly clear that the current proposed extreme funding cuts to Medicaid would force hospitals in Minnesota to cut services or to shut down entirely, full stop. Right now, the current budget proposal that's under consideration in the U.S. House of Representatives calls for at least $880 billion in funding cuts to Medicaid. That is a historic level of gutting of the health insurance program that covers 80 million Americans, including 1.4 million babies, children, new moms, families, people living with disabilities, and seniors right here in Minnesota. This isn't about hypotheticals. This isn't speculation. The basic math has repeatedly shown that if Medicaid were to be cut by $880 billion, millions of people would lose health coverage across the country, and hospitals in Minnesota will be forced to cut services or shut down entirely. You'll hear directly from our local hospital leaders on what the proposed Medicaid cuts would mean for services, clinics, and care here in Minnesota. But we're here to ring the alarm bells today because we simply cannot have services cut and hospitals shut down in our state. It would be a disaster. But that's exactly what is at stake. Every Minnesotan should know this because this isn't just about the 1.4 million Minnesotans who get their health care through Medicaid or medical assistance, as we call it here in Minnesota. This is about the fact that if one of our level 1 trauma centers in the metro closes down, that's one less place you can go when you or a loved one has a stroke or gets in a car accident. This is about the fact that if another hospital in greater Minnesota has to shut down, Minnesotans will have to travel so many more miles to get to the next nearest place to get care. This is about the fact that our healthcare system is already strained, and these Medicaid cuts would only mean more services cut, more strained healthcare systems. We would all pay the price. I just want to be really clear that these cuts have consequences, real consequences for all of us, and we can't let them become a reality. Which leads me to the second point I want to make. There is hope. We can stop these proposed cuts. These cuts to Medicaid have not yet been finalized. Standing up, speaking out, sharing stories, all are happening and creating real public pressure, and it is working. I was so heartened earlier this year when more than a dozen Minnesota Republican state legislators sent a letter to President Trump and the Republican members of Minnesota's congressional delegation imploring them to not cut Medicaid. They highlighted the dangerous threat that the budget poses to Minnesotans' health and economy. They very correctly called these proposed cuts unworkable, unmanageable. They said it would devastate services and put incredible pressure on the state budget. Then just last month, a dozen congressional Republicans sent a letter to their leadership voicing their opposition to Medicaid cuts. And then just this week, House Republicans had to push back the committee hearing that they had scheduled to release the specifics of their Medicaid cuts because they're facing increasing pressure every day. And the resistance opposing these cuts is only getting stronger. And that's because people understand how harmful, how devastating these cuts would be. They have joined the fight to save Medicaid. Patients, providers, hospitals, state legislators, federal legislators, the American people are coming together to save Medicaid. And here's the thing, this cannot and should not be a partisan issue. Healthcare is not a partisan issue. We all need it. No matter where you live, who you vote for, everybody needs access to healthcare and open, functioning hospitals. As a physician and on behalf of all Minnesotans, I will continue to fight these cuts every single day. And I know there are a lot of people in this fight with us. So with that, I'm going to turn it over to Minnesota Hospital Association President and CEO, Dr. Rahul Khurana. Thank you, Dr. Khurana.
Good morning, Congresswoman. Could you or your team, could you hear me now?
We can hear you. Good morning, Doctor.
Good morning, Congresswoman. Thank you so much for your words. And also, obviously, thank you so much for your years of service here at the state legislature, your years of serving patients, and now, of course, serving all Americans in Congress. So thank you for having this very important press conference. I'm Rahul Khurana, and just like the Congresswoman and one of our other speakers after me, I am also a physician. And I have worked actually at the beginning of my career at the smallest hospital in rural Minnesota for 5 years. So I could also talk about some numbers like the Congresswoman did, 1.3, 1.4 million Minnesotans on Medicaid, 1 in 3 births and moms, are on Medicaid. And in some hospitals, over 50% of births are supported by Medicaid for the mom and the baby. So this is a critical program. And I could give you many more numbers, but I'm going to take you to the front lines of Minnesota hospitals and what I hear when I travel around the state. Our hospitals in Minnesota are almost all not-for-profit, which means that they do not serve shareholders. They do not create profits to give to their stockholders. The little profit, and right now they're not creating profits or a bottom line. What little they create, they pour into their communities. The other thing that I want the listeners to know is that last year, almost half, so almost 50% of Minnesota's not-for-profit hospitals were operating in the red. Medicaid has paid hospitals in Minnesota just 68 cents on the dollar for the last many years. And that is one of the reasons why so many of our hospitals are already underwater. This is before the current Medicaid cut conversation started. Right now, if you look at our state's website, you will see that many of our not-for-profit hospitals are already being forced to cut services like labor and delivery, like mental health services, like many other services their communities depend upon. We also know, and again, I can talk about Starbucks when I was in the hospital there. Hospitals in rural parts of our state are typically the largest employer, employing so many Minnesotans. So when we think about Medicaid cuts, that is extremely worrisome for our hospital leaders and our hospital staff who are working 24/7 to serve patients, not just on Medicaid, but all patients. And I'll just end by making this real for our listeners. A hospital in greater Minnesota, or as you will hear after me, in the metro parts of our state that is struggling and is operating in the red, if that hospital is forced to cut its labor and delivery services, that service doesn't just go away for those moms or expectant moms who are on Medicaid. It also goes away for those moms or expectant moms who may have the very best Cadillac insurance. they will have to also drive the icy roads of Minnesota for hours maybe to get to a hospital that still has that service line open. So we are extremely worried about these significant Medicaid cuts and the policies that are being discussed. So my bottom line that I would love for all Minnesotans and listeners and press to know, the not-for-profit system of care of hospitals in Minnesota is already fragile and on the edge. Any Medicaid cut would break it. Congresswoman, thank you so much for having this conference and standing by our side as Minnesota hospitals try to do what they need to do and what is our mission for all Minnesotans 24/7, 365 days of every year.
Thank you, Dr. Coronet. We will now turn it over to North Memorial Health CEO, Trevor Sawalish.
Hi, good morning. Can you hear me?
We can hear you. Good morning.
Excellent. Well, let me add my thanks to you, Congresswoman Morrison, for bringing attention to this really important issue and for all of the support that you provide to the healthcare system, both in the state of Minnesota and in the country. These are really trying times and really important times, and your advocacy and support is really making a difference. Also, thank you, Dr. Carney, for your comments. I think you've teed it up well. I'm Trevor Sawalish. I am the CEO for North Memorial Health. For more than 70 years, North Memorial has been an independent healthcare system focusing on empowering our patients to achieve their best health. We have 2 hospitals, over 20 clinics that represent over 50 specialties. We're the largest hospital-based air and ground ambulance service in the country, providing care and coverage to the entire state. And we have a level 1 trauma center that has been serving the state of Minnesota for over 25 years. That system represents over 115,000 emergency department visits, over 30,000 admissions to our hospitals, over 100,000 ambulance runs, and over 2,400 air care transports in the state. And we are honored to have over 6,700 employees who have dedicated their careers to serving others. You can tell by those numbers that North is a critical piece of the infrastructure that makes healthcare work in the state and in the region. We're privileged to care for every patient that needs us, irrespective of what insurance they have or whether or not they have insurance. We strive to be here for everybody that needs us every day. But we do have a disproportionate number of patients that are covered by Medicare and Medicaid, and that drives for us immense losses already before we consider any additional cuts. And we're struggling to survive that payer mix at our hospitals and across our system. Last year, that set of losses represented over $180 million for us. And at Robbinsdale in particular, 75% of the patients that walk through our door are on either government payment or self-pay. We are not alone in struggling, as Dr. Crowley described really well, but we are unique in that we are a safety net hospital that really gets no additional safety net supports. And that is leaving us uniquely vulnerable right now before we consider any additional cuts to Medicaid. We are already struggling at these current reimbursement rates, and anything that would affect Medicaid reimbursement for the care that we would deliver would be catastrophic to us. It would mean closures, including a reduction of our level 1 trauma center, changes in the number of beds that we have specifically at our Robbinsdale Hospital, or even possibly closure of Robbinsdale Hospital altogether. It could also mean a retraction of our EMS services and clinic services all across the state. All of these services are there to serve patients in every corner of the state and across the region, and they're not just there for our Medicaid patients, they're there for any that need us. Every day we serve thousands of patients, your family members, your neighbors, and we just want to be able to continue to do that as we have for over 70 years. But these cuts, any additional cuts on top of the challenges we already have, would be absolutely catastrophic and will have an impact to the services that we provide. So again, thank you, Congresswoman Morrison, for bringing attention to this. Thank you for all that have joined to pay attention to this important issue, and look forward to any Q&A.
Thank you, Mr. Sawalish. We will now turn it over to Hennepin Healthcare System Chief Medical Officer, Physician Dr. Eric Ling.
Thank you, Madeline, Trevor, and Rahul. Thank you also to Congresswoman Morrison for inviting us here to speak today, being the incredible advocate for Medicaid that you are. I'm Eric Lang, Chief Medical Officer and Emergency Department Doctor, much like the Congresswoman and Dr. Karani, seeing patients and trying to take care of patients every day. Hennepin Healthcare has been caring for Minnesotans for 130 years. And like North Memorial is a safety net for the region, for the state. Half of our patients rely on Medicaid. And I think you've heard already that it's important to understand that Medicaid doesn't just help Medicaid patients. It supports the entire healthcare system and infrastructure, including those with private insurance, those with Medicare. And if the impending Medicaid cuts go through, or even a portion of them, we could not provide our level 1 trauma care either for pediatrics or adults. We couldn't provide comprehensive stroke center for the community or accredited burn center. We have the only 24/7 emergency hyperbaric chamber between Milwaukee and Salt Lake City. Without Hennepin Healthcare providing that service, critically ill patients in Minnesota or the Dakotas or Iowa with necrotizing infections that need hyperbaric, whether or not they have insurance or Medicaid, we'd have to fly them across state lines and sometimes across multiple state lines. We're also the state's only inpatient psychiatric intensive care unit. We house the state's Minnesota Poison Control Poison Center. So if a 2-year-old, again, with or without Medicaid, accidentally drinks a bottle of Tylenol because it tastes like grape syrup, which happens surprisingly often, we answer the phone when a distraught mother calls. That's what we're here for. We train 60% of the doctors in Minnesota who go on to provide care at facilities all across the state and across the nation. Without Medicaid, none of these things could be sustained. Beyond the community level, it clearly impacts individuals as well. Medicaid funding changes lives and saves lives. As a practicing physician, I see this firsthand when patients can't access care. I see what happens. For example, I had a middle-aged man presenting to the emergency department. He was coughing up blood, and he described recently qualifying for Medicaid and wanting to just have it checked out. For many years, he'd been an independent contractor working construction. He had never earned enough to really afford health insurance or to qualify, but he also earned too much to qualify for Medicaid. And consequently, his family did not have insurance when his wife got sick. And so she had abdominal pain for several months. She did not come in to be seen. Eventually, it was so severe that she presented to emergency department, was found to have advanced cancer that was too late to cure, and she passed away after a long battle with cancer. The man in front of me was incredibly grateful for her medical care. He ended up spending down all of his assets to pay her medical bills, and he wasn't working because he was taking care of his wife, barely scraping by. This is an all too common tragedy, and the only silver lining was that having reduced his assets, earnings to care for his wife, he now qualified for Medicaid himself. And coughing up blood in front of me was the first symptom of his own cancer. And this time, because he was caught by our Medicaid safety net during the hardest time of his life, it was discovered early and was curable. This patient's wife did not have insurance, and she tragically died. With Medicaid, this patient lived. So sweeping cuts to Medicaid, it's the foundation of our safety net healthcare infrastructure. Those cuts will not fix what is broken in our healthcare system. Instead, it would tear a hole in the safety net that every one of us may need at some point, with patients, Minnesotans, Americans everywhere falling through that. We're immensely grateful. Thank you to Congresswoman Morrison again for your leadership, to everyone else on this call, protecting Medicaid for our patients, and advocating for our communities.